Hey guys, Blake here from the Fountain in West Palm Beach. Going to walk you through how to do a subcutaneous injection and how to properly use our insulin syringes. So, insulin syringes, again, primarily used for peptides. If you guys are doing a vitamin B injection or any other vitamin injection on a weekly basis, subcutaneous, you're going to use an insulin syringe. Just the easiest way, most pain-free way to administer those medications. So what we have, our insulin syringe comes with two orange caps on it. Orange cap on the back covers up the plunger, so that's what allows us to draw the medication into the syringe. Top cap, of course, covering the needle. That little guy right there, we're going to keep that on for the time being. Now, on the side of the syringe, we have markings, 10 all the way through 100. That is the number of units. 100 units equals 1 ml. If on your prescription you see anything about milligrams, you don't have to pay attention to that when you're drawing medication. You want to just pay attention to units, because that is going to tell you exactly how much you're putting into the syringe. The correct number or correct amount of medication should come along with that number of units. So let's pretend today that we're doing a 15 unit injection. So there's not 15 marked on here, but we have 10 and we have 20. So we're going to go halfway between those two when we draw it in, but we're not drawing it in yet. We're going to use our bacteriostatic water just for a sample today, but this is exactly what the vial is going to look like. If the vial has a little cap on the top, little plastic cap, it's just a pop off. So just pop it off the top. You'll notice you have a little rubber top here with a ring in the middle. You want to go in the middle of that ring when you are drawing liquid out. Now, before we draw the liquid out, every time we are drawing liquid out of the vial, we want to inject exactly the same amount of air into the vial, because these are airtight. And what will happen is if we're just taking liquid out, it's going to get more and more vacuum sealed, which makes the liquid harder to pull out. It's already kind of tricky with these needles because they're really small. The liquid's, very viscous, so you're not really going to have trouble drawing it out, but you want to make sure you're injecting the air. So again, today we're doing a 15 unit injection. So we are going to first draw 15 units of air into the syringe, ready to go there. I'm then, with the vial upright, going to put the needle into the middle of that ring. We are going to inject the air in. We're then going to flip the vial over, and then we're going to draw 15 units of our medication into the vial. Want to make sure we don't have any air bubbles in there. Good. Have it right at about 15, no air bubbles. Good to go. We pull that out. Now, for the actual injection itself, so I'm going to cap this. I'm not going to inject myself. We want to go into a fatty area around the belly button. So we're going to find that fatty area, a couple inches away from the belly button. Don't want to get too close, but really can be anywhere in the midsection that has a little bit of fat on it. We want to go straight 90 degrees into the skin. So let's say, for example, I'm going to do the belly right here. We want to squeeze the belly a little bit, squeeze the fat a little bit. Don't want to squeeze it super hard because it actually makes the skin harder to get into. So just a light squeeze, kind of get it poking out there. And then we're going to go straight in at 90 degrees. Now, we want to make sure, one thing, that we are depressing the needle or putting injecting the needle all the way in to the point where it is touching, our skin is touching the base of the needle or where the syringe starts. But we don't want to stop there. We actually want to make sure we are depressing the skin a little bit. So let's say, pretend this is the base of the needle and I go in. Don't stop there. We want to press it so we're creating a little bit of a dimple. What that does is ensures that the tip of the syringe, or tip of the needle, gets through the skin and into the subcutaneous layer. If you inject into the skin, not a big deal. What's going to happen is you'll get a little bump. It feels like a bug bite for a few days, but you're still getting the benefits of the medication. But if you do that extra little push, and again, don't just stop here, but kind of depress the skin and create a dimple, it's going to make sure the tip gets through the skin into the subcutaneous layer, and you should be good to go from there. As always, guys, any questions, let us know. Hope this video was helpful.